Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical related information. I'm Dr. Adam Rodnick, chiropractor out of Commerce Township, Michigan, and I'll be your host today.
And I'm your co-host, Dr. Ruvayn Rubinstein out of Troy, Michigan.
And we have a very special guest with us today. We have Dr. Todd Lee, MD.
How are you?
He is a medical doctor, two-time Mr. Michigan, one-time Mr. North America, and Great Lakes Regional Powerlifting Champion.
Yeah, raw.
That's awesome.
That's a lot of credentials you have behind your name, too. That is
Appreciate it.
awesome. So we want to start talking with you first about just a little bit about your experience and how you went through medical school, because it's rare to see a medical doctor that's also into powerlifting, natural health, and physique.
Yeah,
it's cool that you're
it
into
is
that,
rare.
and you have the actual medical and physiology knowledge that you do.
It's unfortunate that it's seen as opposite ends of the spectrum, because to me, it's just one wedge of a pie. Is the body. It's like you understand the theory and concepts, you can operate on the body, you know, hopefully if one starts to die, you can stop it from dying, you can heal it, you can also take a normal body and make it superior through training and diet. And in some regards, some supplements might facilitate that enhancement faster, depending on if they're done perfect or not. And that to me is one category. And that there's a physical application and a knowledge.
It is weird that it seems like two sides of the spectrum, that traditionally you think doctors are more drugs and surgery, medication, surgery, diagnosis, and personal trainers, athletes, bodybuilders are totally different.
Yeah.
And we as chiropractors, sometimes people think of us like somewhere in the middle, or somewhat natural, but we are doctors as well. But it's kind of cool that you have both ends of the spectrum.
Well,
it's the same.
The
Health is
irony
health.
is that the ancient Greeks had the Olympics. They also invented medicine, philosophy, everything.
Yep.
And they saw that the body had to be both mind. I mean, you had to have both mind and body. That was a complete person. Whereas in our culture, it's so materialistic and so down to earth and so against the mind and so against any form of spirituality that the medicine is so pills and surgery focused, a human can't really even heal in the modern Western hospitals. They're so devoid of any type of spiritual or positive emotional state. It's just so sterile and clinical. People think of hospitals somewhere you go to get sick and die.
Well, that's our healthcare system right now is not really healthcare. It's more of a sick care. You think you have to be sick to go get a treatment for something. Well, it should be the exact opposite. People brush their teeth to prevent cavities. People have antivirus software to prevent viruses on their computer, but they don't do anything to prevent things for their own body. They think that they have to wait for that. We always focus on prevention. I know with being able to compete at your level, you need to prevent things. You need to be ahead of the game. The only way to be able to win the competitions you won wasn't because you waited to become healthy. You have to go out and you have to train and you have to do certain things to make sure your body is capable of the rigorous tasks you put it through.
It's almost like the opposite. It's almost like I was raised to be a machine and succeed at every single task set before me. And the key foundation for that is you have to have a physical form capable of supporting the life that your mind needs to inhabit. So if you don't take care of your body, you can't achieve anything.
And don't get us wrong, there's always a time and a place for all traditional means of any kind of medicine or any kind of modality, but it is almost odd that in our country right now, let's say someone's 50 years old, and they say, oh, what kind of medications do you take? I take this and this. What do you take? I don't take any. I almost feel like there's something wrong. What's wrong with you? You don't take any medications at this point?
I know, it's because the medical community is ultimately a business, and the television is a way of convincing weak people to turn to their doctors to make their lives better. Rather than taking matters in their own hands and making their lives better themselves, they go and buy a pill from a drug dealer who wears a white coat. And that's all it really is. It's a big scam to keep people weak so they're constantly sick, so they're constantly taking medication, whereas exercise, massage therapy, and chiropractic care would allow them to be healthy enough they wouldn't get sick, and only a moron would think otherwise.
So let me get back to your training, okay? I want to know how you had the time to become a medical doctor and compete and do all these things at the same exact time. I mean,
there's
I know
no explanation. Just sheer force of will.
Yeah.
I didn't sleep. I would work delivering babies round the clock. I would go to the cemetery and do sprints up a hill in the middle of the night with my pager. I'd go back, I'd sprint back to the hospital, deliver, go back and do sprints. That's all I did. I ate chicken breasts. I would keep them down my pants in my underwear in plastic bags because the other doctors would shame you so much for trying to stay healthy. They were so offended by the idea that someone would want to be in shape and not be out of shape and not rely on pills to stay alive, but to actually keep a healthy body, that they just couldn't handle it. They're very offended by it.
The different, medications that people will take, it can be a good intervention. It can change someone's physiology, but it's not necessarily meant for someone to say, take this and now you have to take it for the rest of your life.
That's how they make money.
Ideally, they prevent the need for it in the first place, and then once someone's on it, there are a lot of exercise, dietary changes, nervous system changes in rest. Everything
there's
from diet, rest,
gazillion
exercise,
things
attitude to increase someone's overall health in order to be able to eventually get off the medication. Obviously, they have to consult their physician and their pharmacist as they're getting off the medication, but there's so many things they can do to change that. And that's something that they have to do themselves. And our society's not set up for that.
It's not that it's set up for that. It's set up so it doesn't happen. The doctors mislead the patients into thinking they shouldn't exercise, and they send them to nutritionists who themselves are out of shape and do not know nutrition. They teach them to eat nothing but fruit, which keeps them obese and soft, so that they're constantly sick and constantly in need of more medication. It has to be intentional to some level. And I've had other physicians look me in the eye and say, we don't teach them how to get thin because they're too stupid and weak to actually do it. It's easier just to do bariatric surgery. That statistically, anyone over a 30 BMI has no chance, so the insurance companies will pay for it. So we put them through sham procedures and sham diets to meet the insurance companies' requirements so that they will pay us to do the surgery we want to do anyway, even though only the diet does the trick. It's not
over
the
30
surgery.
BMI, they don't even have a chance.
They don't even have a chance. We won't even help them. And they lie to the patient's face saying, it's okay, you don't have a chance. They actually intentionally get in their heads and convince them they'll fail just to make money on them.
And like you said earlier, it's mind over matter. You need to be able, if you got your mind set on something, I've seen the stories of people who, you watch that TV show, The Biggest Loser, these guys are huge and they go through those rigorous tasks because their mindset is, I want to get fit, I want to get in shape, I want to get healthy. You could take that each season of that, those same exact people, put them on a different show in a different setting, and every single one of them would qualify for that surgery and never live that healthy lifestyle.
It's cool that they're showing that on TV and that more and more people are watching that kind of thing. And it's inspirational and motivational for people.
A lot of stuff has to be given to Bob and Jillian, though. I don't know if they're still the hosts, but a trainer, my degree that I use the most in training clients to be healthy is psychology, not biochemistry, not neuropsychopharmacology, not medical doctorate, not my years of experience, 24 years of lifting weights, not my 24 years of dieting. It's just psychology. Merely getting the person to stand out of their own way and stop hating themselves is so hard because society is so set up that women are not valuable if they are not thin, and that is not true. And that they mind mess them up so bad about that they abuse themselves with the way they eat, that they're ashamed of themselves, and so they eat to make themselves look worse, to punish themselves, and you have to stop that. And that's why I think the mind of the trainer is a bigger instrument in the success of the client, and that's why I think if doctors actually tried to educate and help the patients be thin rather than just giving up on them, we would have such a different healthcare state in America, more like Canada or Britain, where the doctors are incentivized to have healthy patients, not incentivized to have sick ones.
And I almost think it's very similar with any specialty, not just training, but with any specialty, even in medicine, even with us as well. One of the most important things we can do is educate our patients, let them understand exactly how their body works, what we can do to help them, things they can do themselves. And so there's a lot of people that may not be good physical adjusters as a chiropractor, are good at actually physically doing it, but they understand how to talk to the patient, educate them on the importance. So it's important to have both. I mean, I really pride myself on being a very good mechanical chiropractic adjuster, but I think even more important than actually your physical skill is your ability to educate the patients.
You're a charming dude.
Empower them.
Yeah, you have to make sure the patient understands. I mean, there's only so much a diet can do. I mean, it's very important. But if the nervous system isn't functioning the way it's supposed to, you could be eating the greatest food in the world and your body may interpret it as McDonald's. And you can be eating McDonald's and your body may interpret it as the greatest food in the world if your body is healthy enough to take in the nutrients and excrete the bad stuff. That's what it comes down to. Your body needs to be in a state of healing. When most of Americans, I mean, we're ranked number 49th in developed nations in health. That's bad.
That's just developed nations.
Developed
But
nations.
that's because of how much tax credits and kickbacks and how much privatization there is in the food industry and how dirty the politicians are with how they administer tax cuts for the agriculture. So that grain is then taught by nutritionists to be okay to overweight women, and then that grain is marked up 100-fold by the time it gets in those women's hand. So the government can make all that money off of giving false advice. Whereas if it was using chicken breasts and green vegetables, it would be the base of the food pyramid, would have a better result, had lower diabetes incidence, but less people's pockets would be lined with green paper. And that's why it's done that way.
So we'll talk about briefly some of the things you do to keep in tip-top shape. And I know one, obviously, you mentioned massage therapy, you mentioned chiropractic care. And I know recently you had an accident yourself.
Yeah.
And let's talk about that for a second. We have a video clip of some things that we've done for you. Yeah,
So,
not of the actual accident.
That'd be funny. No, what do you call it? I had a show coming up. I wanted to test the water. So a lot of people think bodybuilding is dangerous. The most dangerous part about bodybuilding is the days without water you go before competition. So if you go to another state to do a out-of-state show for a national competition. For instance, I went to Vegas in July for the Mr. USA. So Vegas is a different climate than Michigan. So we expected I'd lose water. So I fly out Wednesday so I can acclimate to the environment for days, and then let my skin secrete out the amount of water it's supposed to secrete out. We're trying to monitor how much water intake versus how much urine output I'm producing, monitor the sodium level so that we can bring me down so I hit 165 on the scale and then fill me back up so I'm 180 by the time I step on stage 12 hours later. Well, instead I dropped from 165 to 158. So I lost 7 pounds when I was trying to gain 15. So we missed our mark by 22 pounds and I did terrible. So when I was doing this show locally, the idea was to practice my water pulling in this environment and pinpoint exactly how much I'm supposed to have with this new body. Every year your body's different because you built more muscle last year, so you store water differently. So you have to go into it with a different approach. So I was trying my water pull technique, driving to go to the gym to get my arm pump in. Basically, I was going to load a bunch of carbohydrates, hit arms, load up my glycogen supply, drive water into my arms. So when I pulled water out that night, it would come from my skin around the arms, but not the arms themselves, because I loaded on potassium, which causes the water to get stored inside the muscle tissue. So when I'm back, basically driving to the gym, I got into a head-on collision without a seatbelt on. And I crawled out of the car, I got up, and I pushed the EMT off me. I go back to the car to get my gym bag because I had to get to the gym to get my arm pumped because I have a show the next day. So I couldn't walk that night. And my girlfriend's just like, F it, you're going to the show. This isn't like you just to let a car accident beat you. Because the next day I wasn't as sore as it would a normal gym workout. And that's what it hit me. It's like a normal gym workout for one of us is harder than a head-on collision with no seatbelt for a normal person. And that's why they say bodybuilders survive car accidents more than any other person, is I think that the muscle tissue holds your body together in the impact better.
Oh, yeah.
And I got second. I didn't win, but I had Band-Aids all over my face and stuff.
Oh, man. So we're going to show, so he came into the office, and we'll show how chiropractic care can keep athletes like Dr. Lee in tip-top shape. We'll roll the video, and we'll talk about it a little bit afterwards.
Hey, Doc, how you doing? Good to see you. So it's been a while since we've seen Dr. Lee here. He's been a patient of ours previously, and he's a professional bodybuilder and a physician, and he just suffered an auto accident. So he's coming in today. We're going to take a look at him and see what's going on. He's been getting some radiculopathy or radiating down the arm. Right, Doc?
I'm not getting blood flow when I'm lifting with left arm. So the right one will fill up with blood.
Think you notice weakness on the side?
The whole left side is weak.
Okay. So I'm going to do a test here. This is called the dynamometer. It's a neurological test. We're just going to see from the grip strength from side to side. We'll take a couple readings here. We're just going to see if one side is really less than. So I'm going to hold it out. Give it a good squeeze. You're going to straight in front of your body. Perfect. Give it a good squeeze there. You're going to let it go. Just going to do a couple readings so we can do a basic here too. Okay. One more on this one again.
Works for me.
Things can go wrong. So we're seeing a good 20 pounds of pressure different on the left and the right, which is actually a pretty significant difference. So that indicates there's some neurological deficit from that side. So during the car accident, you may have suffered some whiplash that's irritating down the arm and causing that decrease in blood flow, decrease in nerve flow, decrease in even lymphatic drainage and strength as well. So I'm going to do a couple more tests in here. I'm just going to do one thing where I'm going to lift up on your head for a second. And we'll do a full other exam. We won't show our audience that. And then we're going to take an x-ray. And the x-ray will show us exactly what everything looks like in the spine. So I'm going to have you lean back here. And as he leans back, what we're going to do is just lift up on his head to take a little bit of pressure off of the joints. As you can see here, the disc spaces in here, if they're compressed, they can irritate on the nerves. If the whole spine is compressed down, it's going to irritate on these nerve roots. These nerve roots down here, they go right down the arm. So I'm just going to lift up here, and I'm going to have him feel how his hands feel while I do that. So go ahead. See if you can feel the numbness or tingling or the weakness in there right now. And as I have you lean back, I'm going to lean back against my chest, and I'm going to lift up. Go ahead and try to feel again. Your hands low. Feel better when I lift it up?
A little bit more blood flow in the left hand and more my muscle connection in the left hand. I didn't believe it was going to be real, but it actually was. It's weird to see it on the camera, right?
And so there's a lot of other orthopedic and neurological tests that we'll do. We'll save everyone the time. We'll take the x-ray so we can show our audience exactly what the x-ray looks like after we got some objective findings to warrant taking an x-ray on him right now to see what the problem is. So we'll pause our video here. Alright, so what we're looking at here, this is a lateral or side view of the neck. And what we see a lot of times with a whiplash type injury is the neck should curve or arc backward. And when you have a whiplash type injury, body stops, the neck keeps going forward, and it stretches all the ligaments. The ALL, which is the anterior longitudinal ligament, PLL, which is the posterior longitudinal ligament, and another one called the ligamentum nuchae. They get stretched, sheared, and torn, so we start to lose that normal curvature. And so if we look at the x-ray here, you can see that yours is straightened out. And I remember years ago you did have some problem with some straightening, not this bad, but we were able to put the curve back into it pretty quickly. And what I want you to look at here is the difference in the shape of the vertebrae. Can you get a good shot of that? You can see nice smooth edges on the corners here, on the sides, compared to rough, jagged edges here. So here we have a little bit of degenerative change. Now those were there before the accident. However, once you already have some degenerative change and then you get smashed, it makes it easier for some of those discs to bulge or herniate or stick out to the side like this. And then when they irritate on the nerves, those go right down the arm, take away some of the feeling. And you can tell by the dermatomes. We did some neurological testing. Some of the ones you saw, but also some of the ones we didn't see, where we use a pinwheel to check the dermatomes or sensation, light touch distribution areas. We saw some difference in what we call hypoesthesia, where it's not feeling everything as well on those areas.
Most mornings, my ulnar nerve distribution on both hands, I don't have blood flow to. So I'll wake up and I'll be numb or feel extreme pain on the left. These fingers and these fingers. I'm more on the left.
And these are the exact nerves. So again, even though he did have a little bit of discrepancy or irritation before, then you get clobbered, and now we see a much more exacerbated symptom, more symptoms, new symptoms, worsened symptoms, and then also probably the disc has now probably bulged too. Now in an x-ray we see the bones and we see the alignment. We would need an MRI to see the actual soft tissue in the disc space themselves. But most of the time what we do is when we take an x-ray, we see things like this. This is something that I know we can help you out with. And so as we start to work on it, it'll probably continue to get better pretty quickly. If it doesn't after a month or two, then we usually would send someone out for an MRI after 3 weeks, 4 weeks, 6 weeks, depending on the patient's condition. Then we would send possibly for more imaging or magnetic resonance imaging to look at the disc space in the spinal cord itself. But just from looking at this, I think we can really, really help you. So as he moves back here, each of these should squeeze together. Right? These are the spinous process. This is what you feel when you feel the bones sticking out the back. When you go forward here, they should open apart. So you can see as he goes, the head goes forward, the bones don't open all the way. When he goes backward, they're just not squeezing together properly. And that shows us where there's restriction here in the joint capsule themselves. So we're going to get right to work on them. This is called an A to P view. This particular one is called A to P open mouth. So if you look here, Doc, you can see that this little triangle, see that little triangle there?
It's deviated to the left.
You got it, exactly. It should be straight centered. You can see it's shifted to the side. A lot of times when we see that, we'll even see headaches, neck pain. And in the accident, you were driving, correct?
Yeah.
And so what a lot of times we'll see is, let's say, someone's buckled up like this, or you weren't buckled though, right?
No, I had no seatbelt.
Did you turn your head to the right when it happened?
No, I just put my hands up over my face.
Okay.
Because I knew I was getting launched in the steering wheel.
And I have a feeling you actually had your head slightly turned to the left a little bit as you did it, because when that happens, that deviates to the left automatically a little bit, and then it hit, which made it stay there or continue to be subluxated or juxtaposed in that position. A lot of times with that, we'll even see some symptoms like headaches, sometimes even dizziness, sometimes even ringing in the ears. Have you had anything like that?
Yeah, but that's pretty normal for me.
Oh, no. So let's, we'll go out there on the adjusting table, we'll get right to work on it. Alright, so as I'm working in here, Doc, you're going to hear some little popping noises. All it is not really going snapping, cracking, or popping. All it is pressure. Basically air bubbles coming out of the joint space as we're opening the joint capsule. It's basically CO2 and nitrogen gas, like opening up a can of soda. A lot of tension through the upper back here, too. So next thing we're going to do is the drop table. It's going to click up, it's going to drop down. This is to help reset some of the vertebrae in the lower back, and also the hips, the pelvis. To adjust and manipulate the sacroiliac joints as well. Let's go right on the side here, facing towards me. I actually get a workout when I'm adjusting bodybuilders too. I'm going to bend this knee. See, nice deep breath. Let it out. There we go. We'll go right on the other side. Let me set you real quick on something that's a little more down. So I think he was wanting to work up to the hanging wall. Let's go right on your back here. Put you on it just for I'm just going to stretch your neck here. Maybe feel it open up a little. You hear these ones a little louder, probably. Sit you right on up here. The instrument we use. Here's some little pops. We use this to hit some of the tight trigger points in the muscles, break up some scar tissue and adhesion. Gently maneuver some of the bones as well. So what I'd like to do now, we're going to grab our dynamometer again, and just after the little work we've done, just the thumbnail just to start with today, we're going to just recheck that and see how we do it with strength. Let's check again here.
With that, actually.
And let's do one more, get a nice base of comparison here. And let it loose. Let's switch it over here. Let's go the other hand. And so again, we had about, we're up about 8 pounds of pressure from before. So we're getting a little bit of innovation back just to start with.
80 to 80 to 68.
Yep, exactly. And we like to do a lot of objective criteria to show what we're doing is really helping, and to see if we need to tweak what we're doing, modify our routine along the way. But you know, we just started. That was really momentarily and instantaneously.
That was the first visit.
We saw quite a bit of response already too. So we'll continue progress and see how it goes.
Thank you, sir. It's like a neck stretch.
All right, so we just showed a nice video clip of exactly what goes on in Dr. Rodnick's office and how it can help someone recover from an accident like that. I mean, you said you came in second place. That means a whole bunch of people did worse than you, but that means one person did better. And that's what we want to make sure that next time we can get you into the shape that you win these competitions. We need to keep you. But you were speaking of all these like fancy terms earlier, and it's got to help that you're a medical doctor when you're doing all this training, understanding the physiology behind why you're doing it.
We'll talk about that in the next show we have upcoming too, the actual physiology.
The funny thing is that's pretty much my niche here in Michigan and across the world. Is a lot of people see me as the expert on the super complicated high-end science, And I'm not just good at one of these subcategories. It's like across the board, from the pharmacology, the endocrinology, the musculoskeletal stuff, how to train for it, how to eat for it. The super high-end stuff that this scientist figured out this piece and this, I'm the guy who ties it together. So people come to me for greater understanding on my website, toddleemd.com. That's where I go over the basic really stuff. The super, super, super dark underground stuff is on operationragnarok.us. And then I've got a supplement company of the most advanced stuff that's over the counter in the world, really, is valhalla-labs.com.
We'll go into those specific products the next time we have the show as well. But we just had a couple minutes left. Let's just talk a little bit about that video clip, about some of the things that we did. And do you notice, when you're getting massage regularly, and especially when you're getting adjustments for your nervous system, do you notice more strength output?
Rather than notice, I went and actually measured it, because that's what I do. Is that I did I have 1 week of my T4R training system. I developed my own training system. Because like any egomaniac, I have to do everything my own way. So the first week is the strength week, Thor week. I just call it that because it's easy to remember. God is strength week. I added 10 pounds to my overhead press after you'd adjusted me. I added, I think I went up 20 pounds on my bench but lost 2 reps. So basically across the board with everything that involved that left upper limb, because for those who didn't follow in the video, the C7, C5 range had some type of occlusion to the nervous.
And we saw that in the video x-ray. We saw the restriction. We saw where it's irritating on the joints. That's causing irritation in the nerve.
So this whole limb ain't gonna work perfect. That's the bottom line.
That's it,
In
exactly.
layman terms, it's like this not working right. Like, oh, it sucks. So the point is he made it better. So this one, I went up 20 pounds. So in 2012, I could do 165 for 5. Now I'm able to do 195 for 5. It took me 2 years to get over that. This shot me up half that distance. So it doubled my rate of increase for that one move in 1 week. That's the biggest overall way of determining just upper left limb strength without any other thing is overhead press in this instance. So that alone, that in 2 years I made X amount of progress with one adjustment. After that, I doubled that progress. That's how much the car accident sent me back. That's how much you helped with one adjustment.
Awesome.
Well, thanks for coming on the show.
Thank you. It was a pleasure to have you, Dr. Lee.
No problem.
This has been Ask the Chiropractor. I'm Dr. Adam Rodnick out of Commerce Township. I've been your host.
And I'm Dr. Ruvayn Rubinstein out of Troy, Michigan.
And you stay healthy. We'll see you next time.